Okay, so good morning, everybody, and welcome to our Georgia Essentials for Childhood annual meeting. We're just super excited to see so many people have joined, and we might have a few others that will join us here momentarily. We're going to go ahead and get started to respect everybody's time, and hopefully, you guys are safe around the state. We've been experiencing some heavy weather over the last couple of days, and hopefully everybody's remaining safe. So we'll go ahead and get started. Matthew, you can advance the slide for me, please. All right, so here's our agenda for today. After I finish with our brief welcome and introductions, we are going to have a quick overview of what Georgia Essentials for Childhood is. Then what we're going to do is we're going to reflect on everything that has happened since our last meeting. We have 5 amazing working groups within Georgia Essentials for Childhood: communications, data, policy, programs, and CANA, which is Child Abuse and Neglect Prevention Plan. And each one of them will report out on the awesome work that they've been doing over the past year and all of the progress they've made since the last year. After that, we're going to dive into the state plan, and we're going to, you're going to get some of the information on a lot of the new innovation and ideas around implementation for the upcoming year. After that, we'll have the Department of Public Health PACE Data to Action update. And then we'll close out the day. And as Matthew said, we'll still try to get you guys out of here at 11:30 as planned. So you can advance the slides. I'm going to introduce you guys to the awesome team of folks that make up our backbone organizations. So our backbone is DFACS's Prevention and Community Support, Prevent Child Abuse Georgia, and the Department of Public Health Injury Prevention Program. And every one of these individuals, Lisa Dawson, Grace Morrow, Jennifer Stein, myself, and Laura, will help guide you through today's activities as we go along. So you'll get to meet these folks in person. Move forward. Again, welcome everybody. I am excited to have you guys here. We have an exciting and amazing agenda on tap for you guys, and we're ready to get it started. We're going to start it off with introducing you to what's called inclusive conversations, formerly civic dinners. And that is a model that provides a structured conversation that allows every voice to be heard. And there are 6 conversations, and we're going to experience one of them today. Go ahead and advance the slide, Matthew, please. All right, so like I said, inclusive conversations is a model, and it's like a structured conversation for individuals. And we're going to go through one of those today. In that conversation, the ideal participants, it will be 4 to 8 people in that group with a host. There's 3 big questions that are covered, and we're going to ask some specific questions to get your minds and your gears working, and see if we can get some good thought and conversation going as far as that's concerned. So we want everybody to have an equal time to share, and we want everybody to speak one at a time. And once we get started, Matthew is going to divide each of us into breakout rooms. All right, so advocating for family and child well-being. We all know the saying, it takes a village to raise a child. But how do we apply this wisdom to our children right here in Georgia? To truly support child well-being, we must look beyond the family unit to address the societal factors that set families up for success. And we need to do it together with the help of our friends, neighbors, co-workers, business leaders, and the faith community. Together, we are all invested in a promising future for Georgia. This is a conversation on how we can come together as a village to help children thrive and build a better future for us all. All right, so when you are put into a breakout group, into a breakout room, we want to make sure that we're all using our active listening skills, listening to what everyone is saying, listening with curiosity. We want to make sure that we're fully engaged and participating. We also want to appreciate new ideas, authentic ideas, and conversation that we may not have heard before. We want to respect those who have lived experience. And most of all, we want to enjoy the experience. All right, so once you get into your breakout room, what we want you to do is share your name and where you live first. And then what inspires you to be an advocate for family and child well-being? That's just a way for you guys to get to know each other before we dive right into these deep questions. Question number one, family well-being depends on access to jobs, quality childcare, health and wellness resources, stable housing, and financial opportunity. But not every community offers these things in equal measure. For example, Atlanta sits at number 1 in the nation for income inequality, a factor that can determine whether or not families have even the basics that they need for their children. So here's the question. When it comes to the well-being of children growing up in Georgia, what's one thing that breaks your heart and what's one thing that gives you hope? One thing that breaks your heart, one thing that gives you hope.
What we'd like to do now is provide a brief overview for everyone about Essentials for Childhood in Georgia, Essentials for Childhood, those two items. We know some people are coming to us, coming to the initiative for the first time today. And so we do want to make sure everyone's sort of brought along in this conversation. So Essentials for Childhood is a framework for the Centers for Disease Control and Prevention. When it was developed, it has the purpose as a framework of cultivating and fostering and promoting safe, stable, nurturing relationships and environments. And it sees these as essential to preventing child maltreatment and ensuring children reach their full potential. You can learn more about Essentials for Childhood from the CDC's website as part of their violence prevention program, and we've posted that link in the chat for you. Also know all the slides from today's session will be made available to you after the meeting. So if you missed something in the chat or aren't able to take a picture or screenshot or jot something down that you see up on the screen, we will get all of these slides out to everyone after today's meeting as well. So then Georgia Essentials for Childhood is the name that we've given the initiative here in our state. And our mission is to develop a common approach across multidisciplinary organizations and stakeholders. And we're trying to align activities, programs, policies towards safe, stable, nurturing relationships and environments, just like you heard on the main CDC framework's mission, aiming at children, youth, and their families. And so our vision as a statewide initiative is that Georgia's children and families thrive in connected, nurturing communities where they live, learn, work, and play. In the chat, you can find the homepage for Georgia Essentials for Childhood, and it is hosted by PCA Georgia through the Georgia State University domain. So when you see that in the chat, that's why their web address is built the way it is. This is a listing of the steering committee that provides sort of governance and oversight for the Georgia Essentials Initiative. We have many different organizations represented on it, nearly 24. And we just want to acknowledge for a moment the participants in the steering committee for their leadership. There are 5 working groups within Georgia Essentials for Childhood. Nearly 50 organizations participate in the working groups in the steering committee. And it's within these 5 working groups that a lot of the actual work, the activities, the projects of the initiative take place. We'll be hearing brief updates, annual reports from each of these 5 working groups during the course of this morning. These are the co-chairs of the 5 working groups whom we'll be hearing from later today. And we also do want to thank and acknowledge a few people who have left leadership roles within the initiative over the last year, either as steering committee members, so Matthew Clay, who is our colleague from DBHDD, or as a working group chair. So Julia Neighbors from Fulton County Juvenile Court at the time, and Elizabeth Otwell, who came to us through DPH's Injury Prevention Program. Thank you again to them for their service and dedication to the initiative. So now I'd like to turn it over to our colleague Laura Griggs from the Prevention Community Support Section at DFACS, who's going to facilitate us through a review of the working groups and their efforts over the past year.
Thank you, Matthew. We can go to the next slide. On your screen, you can see kind of a schedule of the different working groups when they meet, as well as contact information for the co-chairs. So if you're not already part of an Essentials working group and you would like to join, just maybe take note as they present the work that they've done this past year and see which one you might be interested in joining. And as Matthew mentioned, the information for the work groups will be in the chat, and also you will receive it after the meeting. So first up, we are going to hear from the Communications and Outreach work group. So I am going to turn it over to Liz and Grace.
Thanks, Laura. Hi, everybody. Good morning to you all. My name is Grace Morrow. I'm one of the co-chairs of the Communications and Outreach Working Group, along with Liz Ferguson. Liz, do you want to say hi? If you're on.
I am. Good morning, everybody.
Great. We can move to the next slide. Okay, so this is a list of our current working group members. If anyone is interested to join, we would absolutely love to have you. Liz and I are a good time, so feel free to send myself or Liz an email if you're interested. But we have a pretty wide variety of different folks from various different sectors across the state, and we're really thankful for all of our members. Next slide, please. For what we've done, so the goals that we had for this past year, we really wanted to focus on creating a lot of social media collateral that can be used for the implementation of the Child Abuse and Neglect Prevention Plan that Georgia Essentials helps to implement. And then we also wanted to create additional collateral around child and family well-being for any Georgia Essentials members. So that's what we've put a lot of our focus on. And by collateral, I mean, you know, Facebook postings, presentation slides, things like that. We also have a variety of different fact sheets and collateral from previous years that we wanted to update so they had the latest information in them. And then, of course, we're always, since we're the Communications and Outreach Working Group, a lot of times if the other working groups are doing something where they're creating a product, they'll come to us and ask us to look things over. And we also look things over for other Essentials members as well, if they'd like to. So those were our goals for the past year. Next slide, please. So some of the successes that we had, we were able to complete our white papers. So if you are not familiar with the Child Abuse and Neglect Prevention Plan, CANP, Matthew just spelled it out in the chat for us. That is the state action plan around preventing child abuse and neglect. And there are 6 objectives within the CANP. And the communications group created a series of short white papers on each of those objectives to talk a little bit more about what they mean, and also what some of the actions or events that are occurring around the state to address those are. We've also been working on updating a one-pager for essentials. So this is just a front and back flyer or page that explains a little bit about what Georgia Essentials is. And then lastly, we've got some ongoing development of continued collateral that Liz has been working on around some presentation slides and then other types of collateral to be shared. Next slide, please. Now for the upcoming year, again, we're gonna keep developing things. We are constantly in development of new materials, whether those are sort of materials that we change every single year, or if we've received feedback from Essentials members or folks that are implementing the Child Abuse and Neglect Prevention Plan that they'd like certain types of assistance with collateral around social media or presentations, then we'll start working on those too. One of the things that we're going to be working on a lot this year is an implementation guidebook for CANIP. We're going to be helping out Beth Florence with that. I'm sure Beth is here somewhere. And then, yeah, kind of the other big thing is making sure that we're just consistent in the messaging that Essentials, but also Essentials members and partners throughout the state use when talking about Georgia Essentials or talking about CANIP implementation. I think that was it. Yeah, but if you want to join, you want to hang out with me and Liz on the first Friday of every month, please feel free. Yeah, our next meeting is tomorrow. We meet for about an hour. And yeah, you're more than welcome to join, or you can come maybe join us in October. Liz, is there anything that I've missed that you want to share?
Nothing to add.
Okay, perfect. Thank you so much. I'll turn it back over to Laura.
Thank you. And yes, I can speak from experience. Grace and Liz are a good time. So if you want to have fun, you should join this work group. Okay, and I'm going to turn it over to someone else who is fun, Rebecca Hudgens, for the data working group.
Thank you, Laura. I'm glad to hear you say that that our data working group is fun. I love people that think data is fun because I think data is fun and interesting. So our data working group, the first thing I want to do is thank our members. We have a number of working group members that have really contributed a lot of time and effort and thought to how this working group can support the CANIP implementation across the state. So I'm really wanting to say a big thanks, and also, as Grace did, an invitation for anybody that's interested and thinks data is fun like the rest of us do on the working group to join us on the fourth Wednesday of every month in the morning. Next slide, please. So our accomplishments in this past year have really been to complete the analysis, thanks with public health, and dissemination of our ACEs data through regional fact sheets. The BRFSS, if you're not familiar with it, is the Behavioral Risk Factor Surveillance System. And this is where we are able to collect data around ACEs prevalence in the state, and then through public health support, also be able to really use those data to create the fact sheets, both at a DFACS regional level and at a DHS regional level. So those have been really, really useful for all of the counties in the state and the regions that working with their CANIP regional plans. We are also working and have almost finished our identification of indicators of progress to align with the 19 CANIP strategies. Again, all of this work is really around supporting both the CANIP at a state level, but also those regional CANIP implementation plans. Thirdly, as I just mentioned, providing data support. Occasionally we do get questions from the CANUP regional working groups around where they may find a particular type of data that they're looking for, or what other kinds of questions around data interpretation, or what we like to talk about as data literacy, understanding how to use available data to help make decisions and to help plan and implement activities in communities. We're excited that in this next year, we're going to actually have the addition of new questions that are around positive childhood experiences. I think we've added 3 new questions to Georgia's BRFIS data collection. So for the first time, we'll have some information about positive indicators and not just those indicators that we normally collect in public health and other fields around deficits, right? And then finally, continuing to work to align our data sets, data resources, data sources and systems. One of the things that I hear a lot from community is just questions about where data is located, what data is collected, and how can I use it, especially at a county level. So this working group is really devoted to providing that kind of support and identifying and working across agencies and organizations to find those county level data and sub-county level data that is useful to community. Looking ahead, we will continue with our data management and connecting with each other and sharing data and where is it and how can we use it. Continuing to work with providing data literacy support, training, and information among the communities and other key audiences that just ask the question, well, this is all interesting data, but so what? And what do I do with this data? And how does it help me to plan and implement useful and meaningful and effective programs in community? And also think more about how do we use these data to tell the story of what is happening in communities and how to engage more people in understanding how the data and what the data means at a community level. So if you're interested in data literacy and working with communities around data and getting useful data out to communities, you're more than welcome to join our working group that meets on the 4th Wednesday of every month in the morning. Thank you, Matthew.
Thanks, Rebecca. Yeah,
Thank you, Laura.
Lots of great work being done. And now we are going to hear from our next working group, the policy group, Melissa and Hannah.
Good morning, everyone. Can you all hear me okay?
Yes.
Great. Thank you, Laura. My name is Hannah Goldberg, and I am here representing the policy working group. Typically, my partner in crime, Melissa Haberlin, would be with me as well. We work for 2 child advocacy organizations. So GEARS is the Georgia Early Education Alliance for Ready Students. We are a statewide birth through 5 policy research and advocacy organization, and our friends at Voices for Children work more in the birth through 24 space. So they do a little bit more than we do across a number of different ages. But we together represent the co-chairs of the policy working group. Next slide, please. So first, sort of want to talk about what our group does, big picture, and why policy. So, when we think about children and families, we know that they're situated within communities and are affected by all kinds of decisions that are made under the Gold Dome and at child-serving state agencies. And so the policy working group primarily functions as that liaison between Georgia Essentials and, the legislative activity, the budget and policy activity that we see under the Gold Dome during legislative session, and as well as some of those administrative impacts that we see at child-serving state agencies. And I want to be really clear here. We know that as advocacy organizations, there are a lot of things that we can do, and we can say that our friends who are state agency employees cannot necessarily do or say. And at the same time, when we look at the priorities of Georgia Essentials and we look at the CANIP, we know that we can never truly move the needle until we consider policy change. And so that is predominantly what we have seen our role as, is really to serve as that liaison, to make sure that Georgia Essentials is aware of what's going on and what impact those policy changes could have on children and families across the state. And then to make sure also that leaders are aware of Georgia Essentials and from a policy perspective, what it is, what it does, and why it matters to ensure that children and families can thrive here in Georgia. Next slide, please. I'm going to try to keep this super high level. I know that there is a lot of detail on this slide, but what we really wanted to do is provide a quick update and some big wins from the last legislative session and sort of some things that we're looking at as we move ahead. And we've organized these underneath some of the different CANIP prevention goals. So for example, under increased family economic stability, this past session, legislative session, we saw the extension of TANF benefits to pregnant women. And we will be continuing to look at additional enhancements to TANF that we could see in the coming session as well. Under increased family resilience, we were excited to see 1.7 million added for a home visiting pilot that was really focused on rural parts of the state. And we saw the creation of a study committee on foster care and adoption. In terms of early care and education, we saw the announcement of a House working group that would focus really specifically on pre-K education in the state and what that looks like, and where there may be opportunities to improve that program and also to perhaps expand it and consider where additional needs may exist. We were very excited to also see salary increases for pre-K lead and assistant teachers as part of the budget. And we'll continue to ask for funding, additional funding for the Child Care and Parent Services Program. This is what many of you may know as child care subsidy here in the state. This is a very important program that we know allows parents to go to work and it allows children to attend high quality early learning programs. But because of limited funding, we know we're only serving a fraction of income eligible children. As an example of one exciting project that we're working on, and you'll hear a little bit more from the programs group, working group, but we're really excited to partner with them to help collect stories about evidence-based home visiting in this state, to hear both from families as well as from the home visitors themselves, to really understand what their experiences are and what home visiting means to them. It is those stories that are so impactful to policymakers when they're considering making decisions. And so we're excited again to sort of use the programs working group to help us access those folks who can help us tell the stories, and then to help translate and elevate that under the Gold Dome and with other policymakers. Next slide, please. I'm going to breeze through these pretty quickly as well. Under increased family mental well-being, there are a lot of things hopefully in the works that we will see come to fruition this next legislative session, which begins in January, including a pretty significant mental health bill, additional funding for family therapy codes, as well as $1 million for match teams to support collaboration across agencies that would really help meet children's mental health needs. Under family physical health, we saw last session 11 million for DFACs so that they can hire up to 450 caseworkers to help process Medicaid and SNAP renewals, which we know is particularly important right now during Medicaid unwinding. And we also saw funding to eliminate the 5-year waiting period to receive Medicaid for both those eligible children and pregnant women who are legal permanent residents here. Next slide. And I'm going to turn it over to my colleague, Callan Wells, who's sitting next to me to share a little bit about an exciting initiative here in Georgia, sometimes referred to as infant toddler courts. So I'm going to turn it over to Callan now.
Hi, everyone. So we talked about what's happening under the Gold Dome, those legislative activities. But we also know that our state agencies and our university partners are playing a big role in moving forward initiatives that support children and families across the state. So recently, Georgia State University's Center of Excellence for Children's Behavioral Health received federal funding to implement what the federal funding is called infant toddler courts. But in Georgia, it will be called Georgia Thrive. And essentially what this will do is set up 3 sites that are part of dependency courts across the state that will basically take infants and toddlers out of that kind of typical dependency court process and provide those families with significantly more wraparound services and mental health services. And we know that it's really important to focus on this age group for several reasons. First, infants and toddlers are overrepresented in foster care. And second, we know that the early childhood is a really important period for brain development and really sets the stage for a child, or creates a foundation for a child's lifelong mental well-being or mental health. So really critical that we focus on those early years and giving children and families everything that they need to thrive in those early years. In states that have implemented infant toddler courts, especially our neighbors in Florida who have a really robust infant toddler court system, they've seen reduced out-of-home placement time and protection from further maltreatment and higher rates of reunification. Next slide. The other thing we really wanted to talk to you about, Hannah mentioned Medicaid unwinding briefly. This is something that you may have heard about, but is a little confusing because what does that mean? What is Medicaid unwinding? But basically over the pandemic, the federal government said to states, you can't kick anybody off of Medicaid. So if they had Medicaid or they qualify for Medicaid, then you can't kick them off for the duration of the public health emergency. But what they're doing now is saying, okay, we're going to start with these Medicaid renewals again. And so we're unwinding it from that public health emergency that had happened over the pandemic. So many of you know that Medicaid renewals happen every year. They happened every year before the pandemic, and now they'll go back to happening every year. But that means that there are tons of people across the state who will have their Medicaid renewed or their redetermined this year, their eligibility redetermined. And they have until April of next year. We have seen really significant rates of procedural denials. In June, 63,000 children lost coverage due to procedural errors, meaning missing a phone call, not submitting the right documents, things that are often just really challenging to meet all of these requirements. So you all can support families by having them check their gateway site. So the gateway is where you do a Medicaid application. It's where you do a Medicaid renewal. And they should now have in their gateway site the month of their renewal so they can start preparing by collecting all those verifying documents, which often means pay stubs, proof of your citizenship, things like that. You can also go to staycovered.ga.gov for a toolkit that the state has created with flyers and information that you can share with families. Thanks, Hannah.
Thanks, Callan. And I did see a lot of questions in the chat, and thank you, Matthew, for directing those questions my way and Melissa's way. We're happy to answer any questions that you might have by email. And again, you know, we would love to hear directly from you. What we've shared with you is more of sort of a high level overview of what we see going on legislatively as it relates to young kids, along with some other relevant, exciting updates that we've seen in the state that touch children and families. So if you're interested in learning more, please reach out to us. We do not meet as frequently as many of the other working groups, and we try to sort of schedule it around the legislative session so that we can be sure to understand sort of both what priorities are of essentials, but also to provide that feedback loop so that folks are aware of what is happening under the Gold Dome.
Thank you so much, Hannah and Callan. Yeah, there was a lot of interest in the chat, so I would highly encourage you, if you are interested, to join the policy working group. We really appreciate all of the information that they give us, and I know they would be happy to have you. And I think we are moving to our next group. Yes, programs. So I'm going to turn it over to Laura Lynn and Daniel.
Morning, everyone.
Good morning, everybody. I'm Laurelyn.
Me and Lorna are going to share this space. We're missing our one compadre, DeAndre, but I think we can hold it down in his absence. Next slide, please. Our programs working group, here are some of our members, but our main focus is just what it sounds like. What programs can we or are we implementing across the state of Georgia that will increase Georgians' their family well-being? So you see a bunch of our colleagues here on this working group members. Slide here, next slide. Here's some of the goals that we have in mind. We want to support home visiting efforts, and support can look different across the state as it relates to home visiting and programs, because we know that each county is different. We encourage and we welcome everyone to reach out to one of us and share the things that you're encountering, the things that you're experiencing in the context of programs. We also want to define and map child care deserts, right? Again, Georgia looks different across every county. So what does that mean to us when we say child care deserts? We want to identify the need in order to address the family well-being. Parents need childcare, right? And so what counties, what pockets in the state of Georgia that where don't we have childcare? And in order to work and provide, in order for parents to be able to work, right, they need childcare. So our goal is to identify which counties are lacking childcare. And when we say childcare, we mean quality rated childcare facilities, because a lot of counties, they have childcare, but they're not listed as quality rated, all right? So we want to make sure that we are speaking the same language when we define and talk about those childcare deserts, and we want to prepare a map so that we can get that visual and see where those counties are. Another goal of ours is to develop glossary to define and reframe terms like at risk to promote that inclusion and those strength-based thinking and approaches. Again, we want to be able to speak the same language across the state when we say at risk. What does that mean? All right, Laura.
Thanks, Daniel. So just to kind of report out some of our achievements for this year, you know, we have tried to utilize all of our resources at hand. And one of the greatest resources we've used this year is our colleagues over at Gears. Excuse me, I have a cough, but the Georgia Early Education Alliance for Ready Students has really been on hand to support our programs working group through our work. We've developed, again, as they mentioned, an effort to just make sure that our legislators are supported with information about the work that we're doing and the work that's on the ground. You know, Daniel and I are very involved with home visiting, and one of our dreams is to see home visiting available across the state in every county, 159 counties. And that's something that we've kind of wanted to see and we're working toward, but we want others like our legislators to feel that way. And one of the ways that we think that this can happen is to just paint the picture for those folks. Make sure that they know what's happening out there with families. And one of the ways we want to do that is to collect stories. We think that the programs around the state they're the best people to paint that picture. Those home visitors, those parent educators, those folks that are in the homes and working one-on-one with those families. So that's what we're trying to do. Is our next step is to make sure people know how to paint those stories and how to get those stories out to people that need to see them and hear them. One of the other things that we're going to be doing is just really continuing to strengthen those collaborations, those partnerships, those organic partnerships between our 4 working groups here. So those are some of the things that we have done this year. Next slide, please. So as I mentioned, we're going to continue to increase those partnerships. And Daniel, I don't know if you want to jump in too, but please feel free.
Sure. And I want to emphasize too that story gathering. If I can just skip down to that one, continue to support on the vision every through story gathering. I know Hannah touched on it as well as Laura Lynn. That is so important that we share. I know a lot of you are doing some awesome work. It's so imperative that we share these stories and the difference that we're making in our communities. One, because of funding, right? We all know what comes with the funding when it comes to programs, and our legislators, the funders, they need to know that the programs that are in place are making a difference in the state of Georgia, that they're keeping our children and our families safe, and that our families are thriving because of the programs that we have in place. So we definitely want to highlight that story gathering. Don't be shy to share your story. Send them to us. Send them to your state leads. We want to hear about the difference that you're making in your communities. We also want to continue to increase collaborations, making those organic partnerships. Network is a big part of this. Some of our working groups, they overlap and they go hand in hand. Some you can't do one without the other. And so it's going to be imperative that we collaborate, work together, brainstorm, and see that what we can do to implement better programs or to make programs even better that are already in place across the state of Georgia. And then again, just coordinate those efforts, right? Map out that childcare desert. And these are some of the tools that you see here listed that we can use to do just that. The D2A mapping tool, the GIVES Readiness Radar, and then the findhelpgeorgia.org. So those are some of the things that you can look forward to, and we look forward to partnering and collaborating with each and every one of you.
Thanks, everybody. And I see that Matthew answered a question for us. As we go along, you'll hear more from us and how you can support the work. And please feel free to join us. Thank you.
Thank you so much. And I just want to mention, I think, so Laura Lynn received an award at the Georgia Home Visiting Institute this week, and she and Daniel, their organization, received an award as well for home visiting. So I just wanted to mention that and congratulate them. And, you know, if you want to be a part of an award-winning working group, this is the one you should join. So. Okay, and our final working group, last but certainly not least, is the CANUP Implementation Working Group. And so that is co-chaired by myself, Deborah Chosewood, and Jennifer Stein. And I am going to turn it over to Jennifer to report out for us.
Very good. Thank you, Laura. Welcome, everyone. And thank you for advancing the slide. We have over 23 agencies represented in the CANUP Implementation Working Group. And one of the things that we wanted to do this morning before we dive into the recap of the past year is just give a slight introduction to the state plan. Many here today may have heard of it long ago, may need to be reintroduced to it, but we're so pleased that you're here, and we're just going to give you just a little bit of a teaser. And so Georgia's vision for child and family well-being, as you've heard in the chat, it's a 10-year plan, which took over 2 years to develop, thanks to thousands of local stakeholders helping us to collect that community voice. Many of you might have been involved in that at your local regional level, and we thank you for that. And with that, there continues to be ongoing work, and that is happening with the CANUP work group. We'll go ahead and advance the slide, please. From the plan, upon its release in mid-2020, local implementation was critical for success and long-term sustainability. So in 2021, it was all about making sure that we continue to work on implementing the state plan at the local level, at the regional level. Through this, though, it's really important that we've stayed nimble, always focusing on the needs of the families and reviewing this plan annually. And you're going to hear a little bit more about that in a minute. And then every 5 years, we do a complete update to the plan at that mid-mark for the 10 years. Through the plan though the plan was developed in partnership between the Division of Family Children Services, Prevention Community Support Section, and Prevent Child Abuse Georgia, it now lives within Georgia Essentials for Childhood, where the work group monitors and supports that implementation. And you can see here, out of the plan came 6 aspirations known as objectives, whereby working together across all industry sectors, we could collectively improve the lives of all Georgia's children and families. Many of you know that Georgia is currently ranked #1 in the country to do business, yet we are only 37th in overall child well-being. So we have a lot of work cut out for us to improve existing community conditions. And our goal by the end of the 10 years is to be ranked 33rd or higher. Last year, I know we bumped up a little to get us to that 37th ranking. If you want to go ahead on to the next slide, please. The state plan provides a roadmap for us to make the needed improvements, but it needs involvement and support for everyone, from everyone. No single program, strategy, policy, or approach will be enough to prevent child abuse. And you're hearing involvement from all of the work groups from Georgia Essentials that are trying to move the needle on the various goals and objectives. And what does that look like for families? You can see here on the slide, this is the vision we have for families across the state of Georgia. And then if you move forward to the next slide, you're going to see the vision that we have for systems and governments, what we need to look forward. And so when you saw Hannah's slides talking about how the things that they're working on at the Capitol and how they relate to those 6 aspirations and objectives we have for families. And then lastly, the society, the goals for society and how we can incorporate what that can look like for every citizen, every child, every family across the state. And then each community is unique. You just mentioned this, Daniel, when you were talking about home visiting. Each community is unique. And so that's why having all of these different strategies, though there are many that they're identified in the plan, we know that each of these strategies are going to help move the needle, that they're going to improve child and family well-being in the state of Georgia. They're going to improve those conditions that we want to see. They're going to improve family success. So the plan was developed. It's for all sectors in the community. And so when you go about your day-to-day work and you come across different people, please invite them to join us in the implementation of the state plan. And we would be very happy to link you to the people regionally that are working on moving the work forward in the region where these people live. And we'll go on to the next slide and we'll talk just a little bit. This is just a tiny peek at what that timeline looked like in developing it. Of course, those regional implementation. Many of you were probably at those kickoff sessions. Of course, the launch of giving it back to the regions happened in winter 2022. And then annually, we've been reviewing and working with the different regional conveners to get their input, to really understand what's happening in the regions. What are some of those challenges and things of that nature? And you're going to get to hear more about that today. And so we just approached our second review for this now 2023's year. And as we look at that, we can kind of give you an annual calendar preview. Every year we look at, and if you want to look at the next slide, these are some things that happen ongoing. The monthly work group meeting, which everybody's welcome to join. We have communities of practice that are meeting twice a year based on some strategies that were highly ranked among all of the regions across the state. We work with every region to try and help them and support them with regional implementation. We get reports out from them. And then, of course, other activities are happening as we support them. So it's a busy, hopping place and would love to have you join us. One of the things as we look at the communities of practice, these topics, of the 77 strategies that were in the state plan, these topics were of high interest across the state. I'm sure this does not alert you, does not surprise you, the importance of these strategies. And so through that, we developed communities of practice that get together twice a year. Many times we invite experts to come and share a little bit about what's happening, new innovative science that could be implemented. And this is a space for that, a space to share what's happening. And so we encourage you, if some of these topics are of interest, we'd be happy to keep you in the loop of those upcoming communities of practice. They too are happening virtually, and it really could introduce you into other partners across the state that have those same interests, as well as experts that are trying to help us move this work forward. And then one of the things that came about in 2022 is we needed a spot to host all of this, right? A repository, a place to have messaging and communication, share resources, talk with one another, that was easily accessible and well organized based on where you hit within the ecosystem of Georgia. So if you're not part of Basecamp's project management tool, please email us at essentials@gsu.edu. We will get you added. An invitation will come to you. You just let us know where you want to tap in. And I know that we'll be putting in the chat later the Georgia, the state plans link, where you can go and learn a little bit more about what's happening at the local level. But understand this is shifting, this is changing, because it's all about community voice. It's all about working with our local regional partners to understand and support them as they work to achieve those 6 objectives. Now I'd like to just kind of introduce you to two key players in all of this. I represent the co-chair of the work group, and one of our big wish list items, though we have incredible support with Advantage Consulting, we knew we needed somebody to help support the regional. We could use 3 of Beth, but right now we were able to secure funding through the Department of Public Health to have a half person. And so in May, Beth Florence started as the CANUP project coordinator, and a blessing she has been since day one. And then, of course, our fearless leader, Matthew George with Advantage Consulting. Those 2 are going to take you through a lot of things that we've discovered and uncovered that we knew to be true and are now ready to really kind of move this work forward in possibly a little bit new way. So thank you, Beth and Matthew.
Thanks, Jennifer. Can you move to the next slide, Matthew? Thanks. My name's Beth Florence, and I am the CANUP project program coordinator. And when I came on in May, the first thing that I did was to have conversations with the regional conveners. And so to explain, CANUP, when we divided the work to try to work at the local level, we're using the 14 DFACS regions as the sort of hub to find out what's happening across the state of Georgia. So we have a good picture, part of that storytelling of understanding what's happening across the state. So I was able to meet with 13 of our 14 counties, or 14 regions, excuse me, and find out how CANF implementation is going in their regions. Those conversations happened from May to August of 2023. What we found, and what I found in the conversations with many of you who are on this call, is that we have a strong commitment to the mission of increasing positive childhood experiences and reducing child abuse and neglect across the state of Georgia. Of course, that comes with barriers, and that's what we're trying to find out more with CANF. But with CANF moving from the strategy and coming up with regional plans to actually implementing the plans, we found that post-COVID and moving back into face-to-face work, we've seen a reduction in activity with the CANF, in engagement with CANF across the regions. Part of this is confusion about the role of a regional convener, the responsibilities in the regions for what deliverables we're looking for when people are reporting about regional CANF plans. And then because of that, because we've had less activity and lack of clarity, there hasn't been as much attendance. There have been limitations on time with having meetings, and of course there are resource limitations to helping to facilitate that. So some of the successes that we have seen across the state, we've had several regions who were able to develop working groups within their regions and make some headway. They were able to identify connections to existing work in the region, so helping to expand that network and share the work that's being done regionally to address the CANF, the Child Abuse and Neglect Prevention Plan strategies and objectives. Many of these working groups that were put together helped to track progress. They were able to create tools for the region, and that organization regionally helped to share more about what was to help with that storytelling and paint the picture of those specific areas, and also help to get the strategies shared within the regional work. And these successes also came from conveners who were able to share their information about CANF across their regional networks whenever possible. We just need more people to understand what CANF is. I know I saw in the chat at one point, someone asked me, can you define CANF? And it has lots of different names, lots of different pictures. It's the vision of child and family wellness in the state of Georgia. It's the state plan, and it's the CANF. But ultimately, that state plan is the Child Abuse and Neglect Prevention Plan for the state of Georgia. Next slide, please. So one of the big questions that I found when I met with conveners was, what does the convener do? Why do we have them? We're already doing the work. Why do we need to talk about this again? How many regions are how many counties in my region? Because we have some regions that have 18 counties and some that have 2. So the breadth of work is really varied across the state of Georgia. Being a part of CANF often means more meetings. Why are those meetings important? I don't have time for that. And again, coming back to, we're committed to the work, we're already doing it. So you can go to the next slide. So we realized that we needed to make some changes with how we are implementing CANF across the regions. We still need the storytelling, we need the input, we need the expertise of those of you who are doing the work at a regional level. We've had a lot of people today talking who work at the state level, at a high level, but we need to know the details of what's happening in each community so that we can help impact and affect change across the entire state. So with that, we're moving away from sort of being really specific and trying to move more into this theory of change. And Matthew, I'll let you take over from there.
Thank you so much, Beth. It's been a very exciting summer as we've mapped out sort of this evolution, as Beth has well termed it, in our thinking and approach for how this prevention plan provides support to communities and practitioners and children, youth, and families around the state. So as we think about reframing it, we've historically been thinking about the prevention plan as a plan for new strategies to implement. So by adopting these strategies, these 77 within the state plan, and achieving the 6 objectives, the aspirations, as Jennifer termed them, you, the community, the organization, whomever, should be able to reduce child abuse and neglect. And really what the plan is, more clearly, is a theory of change. So instead, thinking, if you're working on these strategies and achieve these objectives, you will reduce child abuse and neglect. So it's shifting the framing from, here's a new plan with new things that you should newly try to do. There's already work happening all over the place, successful work, tremendous activities and organizations and just grassroots innovation across all our 159 counties. So let's start more with thinking in terms of those elements and building blocks and figuring out how they fit into the strategies rather than sort of vice versa. The classic square peg round hole situation that it sort of seemed like our original implementation was going towards. So thinking about this more as a framework rather than a set of unfunded mandates and more work, as Beth termed it. So we're mapping these strategies to what's already happening. And then the key part is really collecting data on the existing impact to show the breadth and the depth of child abuse and neglect prevention. So we're trying to more tell the story of what child abuse and neglect prevention in the state of Georgia looks like, to then be able to influence more collaboration, more partnerships, more funding and support and resources for these successful approaches that are being developed and implemented all over the state. So again, as you can see in that last rectangle, we are explicitly starting with what exists already. And the framework helps link different activities in support of child and family well-being with the overall plan. So as we want to tell this story, we want to make sure that we are recognizing, we are lifting up so many trauma-informed best practices, evidence-based best practices that are happening out there. There's a lot of practitioners and academics talk about evidence-based practice, and we also talk about practice-based evidence. We want to make sure that we're honoring both and making sure that a lack of resources at the moment isn't a hindrance to us finding successful activities and successful innovation in the way that children, youth, and families are supported all over the state. And by collecting that evidence, again, telling the story, like another great example we heard earlier from the programs working group, telling the story about home visiting, here telling the story about child and family well-being and all of these successful approaches. We want to get at opportunities to address gaps and to overcome barriers, and to be able to do that collectively and holistically around the state. And so as we look ahead, we are currently developing some resources, some written, printable materials for implementation in local communities. So for you to be able to take what it is that you're doing and connect it to these strategies, these objectives, to help us tell the story. We're producing guidebooks and handbooks that Beth is leading for the process, tools, and other information. We also want to make sure that your agencies and your organizations, whether you're with state or local government or with a community-based organization, a nonprofit organization, perhaps you're joining us from the business community. Welcome to everyone. Everyone has a role to play in child abuse and neglect prevention and promoting child and family well-being, as Jennifer so well pointed out earlier. And so we, again, are producing resources that will help everyone be able to connect what they're doing to the bigger movement around child and family well-being in Georgia. And the communities of practice are a tremendous way to start intersecting with those conversations and to elevate this into a movement. And as Jennifer mentioned, we're moving in our timeline towards the midway CANEP evaluation, the midway point of our current 10-year plan that was adopted in March 2020. If you can do the math and remember what March 2020 looked like, you can sort of picture what this plan has been up against for a little over 3 years now. But we are rapidly approaching the midway point of the plan. So looking forward to involving all of you in that work and in that midpoint evaluation. So again, as we look ahead, we do encourage you to get involved and to connect with the plan as it's being implemented in communities around the state, in your community, in your region. We have prevent child abuse councils. They're sort of leading the way around the state, and they can help be your initial guide into this. But we also encourage you to reach out to us directly and say, sounds great what you were saying, but where in the world do I start? So you can start out by, again, going to the CANEP homepage, which you can see posted there in the chat. And again, also feel free to reach out to us at essentials@gsu.edu. Jennifer and Beth and other folk here in the initiative are checking that email address, and we'll be very responsive and get back to you quickly. And if any of you had technical difficulties earlier and we're trying to reach out and figure out what's going on, and you wrote essentials@gsu.edu, Beth responded within 45 seconds. I'm not promising that turnaround, but I am using that to illustrate there are real live human beings that you've met here this morning who are on that email address. So please do reach out. If anything here today has piqued your interest and you think, I don't know who to start with, that is the #1 place to go. It's essentials@gsu.edu, and we'll be sure to get you connected. With that, and speaking about this idea of connection, we would like to take one more chance to hear about a tremendous project that is helping to make these connections among all of our agencies, among the players in Georgia Essentials, but really in the greater child and family well-being movement in Georgia. We've had the great benefit of some tremendous support through the Preventing ACEs Data to Action project, which has been funded here in Georgia through the CDC. And I'd like to turn it over now to Grace Morrow, whom we heard from earlier around the data working group, who's a principal investigator at the Injury Prevention Project, to tell us more about the last year of PACES and what we have to look forward to.
Thanks, Matthew. Hello again, everyone. If you're wondering what I do daily, I am the principal investigator and program manager for the Georgia Department of Public Health's Injury Prevention Program, Preventing Adverse Childhood Experiences Data to Action project, which is a lot for me to have to say whenever I introduce myself in one of these kinds of meetings. But PACE D2A, if you're not familiar with it, is a CDC cooperative grant, and we do a lot of things, but essentially the purpose of PACE D2A is to make data around adverse childhood experiences and positive childhood experiences and related social determinants of health available to folks who implement practices, programs, who develop policy all around the state. So our job is to help you get access to the data that you may need to apply for grants, to do evaluation, to determine where might be the best place to run a program, anything related to that. And PACE D2A is originally a 3-year grant, and today, August 31st of 2023, is actually officially our last day for the PACE D2A grant. And we have had so much wonderful success with the grant in the past 3 years. In the chat, Matthew put a link to the PACE D2A website. Our amazing, incredible partners at the Injury Prevention Research Center at Emory University host that website. You can take a look at it. We've got fact sheets. We have a webinar on how to identify ACEs data and PCE data that's helpful to you. And we also have a mapping tool that you can check out that's got a huge variety of different data points. If you need any help related to data around child and family well-being in any way, shape, or form, do not hesitate to email our iPrice team or to email me. A big part of what we do is providing consults with folks. I do presentations on the mapping tool. You have questions, just send us an email and we're going to be really happy to help you. Now, one of the best things about, oh, great. Yeah, I'm seeing some folks from Gwinnett who use the site. Yeah, I remember that. I think we met with you a little while ago. It was really, really great. Anyway, sorry, I got distracted. But we're here for you, and PACE-D2A is really interlinked with the work that's happening at Essentials for Childhood. I participate in all of the working groups except for the policy working group. And we really have based the way that we are finding our data, what data we're focusing on what's going on with Essentials and the needs of our Essentials partners, and also of those who are implementing the CANUP throughout the state. And really, since Essentials was Georgia Essentials for Childhood was originally a self-funded program. Our director of injury prevention program, Lisa Dawson, mentioned that in the chat a little while ago. But when we received the grant for PACE-D2A, we were able to put in some of our PACE-D2A funds to help support Essentials. And now I am very, very excited to announce that we have received continued funding for the PACE-D2A project in a new grant that has an even longer name, which is Essentials for Childhood, Preventing Adverse Childhood Experiences, through data to action. So it's essentially Essentials and PACE-D2A combined together into one project. We are so excited. CDC just released the announcements yesterday, or maybe a little bit earlier in the week. So I was like, yay, I can talk about it on Thursday. But we are so excited to be able to continue this work. We're going to be receiving 5 years of additional funding. And this is going to help support the work that we're doing here at Essentials, but it's also going to be continuing the data analysis and providing data assistance and technical assistance as needed throughout the state. We've got some really wonderful, amazing projects coming up. So if you want to hear more about the new Essentials PACE-D2A grant, as I'm going to be calling it because I can't say that whole thing every single time, please feel free to send me an email. But we have a lot of really wonderful work that's going to be coming ahead in the next 5 years. And it's just going to be really exciting. And we really couldn't do any of this work without our partners here at Essentials. They helped us apply for the grant. They provided us with feedback. They're going to be our closest partners in the implementation of the grant. And yeah, so if you're interested in learning more about it, send me an email, come to some of the Essentials working group meetings, because I'm usually there talking about what we're doing at PACE-D2A. But we're really, really excited. And I wanted to extend a huge thank you to all of our Essentials partners who have, one, put up with me as I've been waiting to hear about this grant, and then two, who helped not only implement the original PACE-D2A, but also make it be such a wonderful, amazing program that we had such a good standing to apply for new funding and now receive it. And I know we're going to be doing amazing work in the future. So thank you so much. I will keep rambling about how excited and thankful I am. So I'm going to turn it over to Matthew, but looking forward to the next 5 years.
Wonderful. Thank you, Grace. We are at the final 4 minutes of our time together, and would really, again, just like to extend our thank you, all of you that showed up today. Even despite some of the technical challenges, you persevered and joined us on this annual meeting. One of the things that you continue to hear is this theme, this collective voice, the collaboration that's involved with Georgia Essentials, and then being able to become a data-driven, data-informed state when it comes to looking at understanding where resources need to be applied, how we can help solve problems that are happening. And one thing that came out of working with the different regions when doing the roadshow for the state's child abuse and neglect prevention plan was this ongoing theme of a resource guide. Many of our local counties at the Georgia Family Connection Partnership annually would do a beautiful PDF, but as we all know, those things would be outdated very quickly. Of course, Prevent Child Abuse Georgia had the 1-800-CHILDREN helpline that was available. It had the resource map that was connected to Neighborhood Nexus. And so as a group, we developed a team that went through and vetted different platforms, so that way we could bring to the state of Georgia a platform and mobile app that would allow anybody to look for free and reduced cost services in an easy to use way. Still, people can access the phone number still being answered by information and referral specialists. They can self-navigate anonymously, and it is translated into over 100 different languages. So you can see in the chat, our project leader, Kimberly Stewart Lucas, has put ways to engage with Find Help Georgia, take a training on how to become a resource navigator, and also how can you get a search bar widget on your landing page of your website? How can you help us spread the word and spread the use? All of you know that the work that we do is really about building supports for families to help them thrive and to help them succeed and to reach that optimal child development. And Find Help Georgia is here to help families and to help those helping families. So just wanted to say that. Also, just opening it up, you learned a lot today. I know we'll be getting a follow-up email to you with some of these contact points so that way you can dive in and get involved, and we encourage you to do so. We also encourage you to invite people to come along with you to learn more and to get involved and to help us move the needle from 37th to 33rd and hopefully even higher ranking for the state of Georgia. If we can be #1 in business, goodness, we can be #1 for families and children too. So thank you for your time today. We hope to see you again in the future and seeing you involved in the work that we're doing. So thank you.